person is Dr. Miriam, and she will be discussing a global grant that took place in Panama on the Manchichi Midwife Health Monitoring Program. So I hope I pronounced that correctly, but take it away, Doctor.
Thank you so much. If I can have the presentation, please, I'd appreciate it. Well, good afternoon, everyone. As they say, my name is Dr. Miriam Rittmeyer, and I am very honored to be here representing Central America in Geneva. I am a Rotarian as well as a co-founder and the CEO of Falarop, a nonprofit organization that focuses on designing, implementing, and evaluating community health and development programs. I'm here today to speak about one of our major programs, which focus on reducing pregnancy-related deaths in Guatemala and Panama. These programs are funded by the Rotary Foundation and Rotary clubs in the U.S., Guatemala, and Panama. We all know that a woman's death during pregnancy or childbirth often means more than the loss of a life. A mother's death increases financial instability, school dropout, early marriage for girls, and mortality for surviving children. For women who survive pregnancy, a maternal morbidity event that is a negative health outcome attributed to a complication during pregnancy can have devastating effects beyond the postpartum period. Due to the COVID pandemic, most Latin American countries had reduced reproductive, maternal, neonatal, and childbirth services, leading to increased maternal mortality. In Panama, the mortality rate doubled among one of the poorest and largest indigenous territories, the Nave-Bulucle Comarca. Next, please. The program in Panama, the Manchichi, can I have the next slide, please? The Manchichi means mother and child. It's a replication of a successful program, the eggshell, developed by Falarop in Guatemala in 2019. I don't know if they can advance the slide, please. This program was established in 8 rural communities of Guatemala and has expanded to 12 more in 2022. So we are in 20 communities right now in Guatemala. The program is an intense 12-month training where traditional midwives are taught to identify risk factors and conditions around a woman's reproductive cycle. I don't know, I think the slides are frozen there, so you can see the next slide, please. Okay. Those certain conditions can be prevented or managed around promptly during pregnancy, labor, delivery, and postpartum. A key feature of the program is our culturally sensitive approach that is adapted to the local culture and language. This increases patient adherence to treatment and the overall acceptance of the program. This includes being mindful of community tradition. For example, in Guatemala, traditional Maya midwives, they burn the placenta and they spread the ashes in the soil for fertility. The Manchichi program in Panama is being implemented in 6 communities and is being evaluated by the Panamanian Ministry of Health as a pilot program for all Panama. Next slide, please. Specifically, this program teaches traditional Nave midwives how to conduct a proper prenatal care visit that will involve a health history to identify underlying factors and morbidities that may be worsened during pregnancy. Conduct a physical exam to look for signs of morbidity developing during pregnancy and referral of high-risk pregnancies. Use medical equipment to measure vital signs, weight gain, and other crucial factors. The training also includes health education that target lifestyle behaviors and family planning. These lifestyle behaviors include alcohol consumption, smoking, and especially poor nutritional choices that we have encountered, like a high consumption of sodas, which are all associated with chronic diseases. Next slide, please. We also teach these midwives how to assess fetal growth and position, as well as proper labor and delivery practices, which includes instrument disinfection. Finally, we teach the midwives to identify signs of infection or conditions in both the infant and the mother during the postpartum period. After this one-on-one training, these concepts are reinforced every 15 days by our field staff, who accompany the traditional midwives on their visits to all the pregnant and postpartum patients. To evaluate the impact of the intervention, our program has developed the first pregnancy, postpartum, and neonatal health monitoring system using geospatial platform used by governments, including the CDC. The platform allows us to map the locations of the households and collect information of the program beneficiaries. Our system can send field information on real time in two formats. One as a dashboard summarizing the information, and the other one as an individual report from high-risk pregnancies, postpartum women, and neonates that are identified at risk and are referred either to the clinic or to the emergency room. The programs in Panama and Guatemala currently has provided around 405 prenatal care visits to 206 women. 48 were referred to for risk factors, and 22 to the emergency room due to conditions that needed to be addressed